Hi, good morning, everyone.
Good morning.
ma'am.
Guys, please mute your mic. So are you all ready to go for the webinar, or do you want me to wait for some more time? Hello, guys. Are you all okay to start now?
Yes.
Yes.
Yes, ma'am.
Okay. Right. So how many of you are currently working?
Yes, I'm working, ma'am.
Okay, you're working, guys?
No.
Okay, so how many of you are working? And can you tell me in which area you are working right now?
Ma'am, actually, I'm working as a medical representative in Ahmednagar, Kopargaon Taluka, Maharashtra.
Okay, okay. Anyone else who has a field job?
Hello.
Hi, Sunil.
Hello.
Yes.
I'm also working, ma'am, medical representative in Nanda quarter.
Okay.
I'm working as a pharmacist in Apollo Pharmacy.
Okay. So again, how many of you are working as a field job? Means daily you go to the field or your workstation?
I need to stay in my branch, but I don't go to the field.
Okay, fine. So, and how many of you are currently studying now? I think many are there, right? Okay, so anybody has any idea what is actually medical coding? A little bit of knowledge, what is medical coding? From your friends, from your network, from social media, anywhere you have any knowledge, what is medical coding? And why to go for this course? There are so many courses in the market. So any ideas?
Well, ma'am,
Everybody
it's a
needs a
blooming
job
industry.
stability, right? Everybody needs a job stability, right? Everybody had a dream that their job should be in a secure place, right? So there should not be any firing, right? There should not be any, what is that? Retardation growth in this field, right? So first of all, we all need a stable job, and we all need a stable environment to work, and we all need a job satisfaction, right? These are
Yes,
the
ma'am.
three choices. Correct?
Ma'am. Yes.
What is actually medical coding? So do you think that it is a stable field?
Yes, ma'am.
Why? Why do you think that it is a stable field? And which industry is actually growing very fast nowadays? Which industry?
Healthcare industry.
Very good. Okay, I appreciate you. So healthcare is the industry, is the only industry. I know IT is also growing, but in compared to IT, so if you will see healthcare, your job will be secured because it is completely associated to human health, right? In IT, sometimes you will see up and down, right? Depends on the market. What's going in the market? What is the new technology, right? Based on that, there will be up and down. So, but healthcare is an industry where you will find a steady flow, where you will find a steady growth, and your job will be secured. In healthcare industry also you have a lot of sectors, but every sectors you cannot completely fit into that, right? Many things are there where you have to go to office and you have to work in healthcare settings. Suppose you are working as a lab technician, your job is you have to go to the hospital or the clinic, wherever it is, and you have to work there. You cannot work from home, right? So you are from, I mean, clinical background field or life science field, but your job role as a technician is, it is your responsibility to reach the office and you have to do all the things there. This work cannot be managed from home. And if you will see by salary wise, not much salary also you will get, right? So anyways, you are going to spend a lot of time in the transportation, you are going to office there also, you are going to spend a lot of time. Your job is also, I can't say that it is the stable job as a lab technician or any job where you are going to the hospitals, but this is a field I can say, till you are there in this field, your job is much secure. And if you are a student from life science background or any clinical background, you will obviously get your job satisfaction because you are going to work with the doctors, right?
Yes, ma'am.
Yes. So what work actually we do in medical coding? Do we work for Indian hospitals? Do you work in for US hospitals or any other country hospitals? Any idea do you have?
Hello.
Yes.
Hi, this is Anjali. Actually, as per my knowledge, I think that to convert patients' diagnosis in a particular code, that is a medical coding, and if we work under as a medical coder, we
Hmm.
can work from home. So that is the best facility.
Yes. But the question is, why do we convert the medical reports to code? What is the need of that? Why to convert it?
Because it is because for health insurance to get the benefits patient to get the benefit from insurance policy. I think we need to convert this diagnosis in a particular code which is arranged by World Health Organization. That is a
Yes.
universal system.
Correct. See, in India, this revenue cycle management process is at all not there. Why it is not there? Because whenever we go to the doctor, nobody asks that you should have a policy, right? Insurance policy. So in India, insurance is not mandatory. It is your choice. If you want, you take it. If you don't want, you don't take it. And whenever you go to the doctor, if you don't have an insurance policy, any treatment you take, no issues, pay from your pocket, right? Pocket se pay karo, yeah, use debit card, credit card, whatever it is, doesn't matter. But there is a great difference in US. What is that? Every individual should have an insurance policy. If you don't have an insurance policy, you cannot visit any of the doctor or you cannot go any of the hospital. Okay, but what is the use of that insurance policy? Just say we take the packages right here in India. Suppose you want to go for a tourism somewhere, suppose Rajasthan you want to go, you want a tourism package. So they will offer you a tourism package and they will give you inclusions, exclusions, right? What is covered in that package, what is not covered. So your fooding is covered, your accommodations are covered, your transportation is covered, yes, but your shopping is not covered. Correct? Exactly same way. In US, they give insurance policies to each individual and it is mandatory. And that insurance will have some covered service also, some non-covered service also. Need to pay only a premium or minimum amount for the insurance. That's it. So the benefits he will get whenever he will go to the hospital, whatever treatment he will take, it will be getting paid as per the insurance policy. He is not going to give anything from his pocket. The doctor will get everything from the insurance companies, right? But again, one more questions. You are going to the doctor, but the doctor will get paid from the insurance company. Now, how the insurance company knows that what service you are taken and how much to pay for the doctors, right? So there your roles comes. Okay, medical coders roles come. So as a medical coder, what do you have to do? You have to read the entire patient's medical information. Okay,
Mm.
medical data, or otherwise, in the terminology which we use, it is called medical record of each patient. Okay, so read entire medical record of the patient, his past history, family history, medical history, whatever is there, and the current present conditions. The entire conversation of the patient and the doctor will be converted to a standard medical record. Read it out and apply your coding knowledge, apply your analytical skills, apply your medical terminology skills, and find out the codes using 3 standard books, ICD, CPT, and SCPCS book. Along with that, a guideline from CMS, which is known as Center for Medicare and Medicaid Service. Apply your coding knowledge, convert the n number of page of medical information to few standard alphanumeric codes. Now the insurance company will have the codes from you. Now they will put the charges for each code. Now what happened here? You precised the data, right? So you precised means you have minimized the data. Am I right?
Yes, yes,
You
yeah.
read suppose the patient's record is of 6 pages. You read the 6 pages and you put only, I'm just giving an example, 3 codes. So how you precise the data and how streamlined it. Now each code has a dollar value. Now the insurance company work is now very easy now. He will just see the codes and he will release the money accordingly as per the code to the doctors. Now did you guys understand what is the importance of medical codes here?
Yes, ma'am.
And how
Yes, yes.
important it is, right? That matters, how important it is, correct?
Yes. One more question I would like to ask you. Is it essential that the medical coder should have a life science background?
It's not at all mandatory, okay? Why it's not at all mandatory? It's not my thought, okay? So organization, there is an organization which is known as AAPC, American Association of Professional Coder. One more organization is there, AHIMA, okay? So these 2 organizations, they are located at USA, okay? These are the 2 organizations who conduct all the codings certifications. So this is the major body who controls the coding. So as per their thought, diploma users also, they can take up the medical coding training. Degree is not mandatory.
Mhm.
And you need to have a science background at all.
Okay, but without
Not
certificate,
mandatory.
yeah. And but without certification, would that be very difficult to get a job? Means certification is essential to get a job.
See, nowadays, everywhere you will see plenty of opportunities, plenty of competitions, right? So if I have a certification and you don't have a certification, if I want to grow my ladder, then
Yes.
obviously they will give the preference to me because I have something extra than you, right? So
Yeah.
that matters. That's it. But doesn't mean that you will not get a job. You will get a job. But there is a slight difference. The certification which you are taking from AAPC, that has a weightage, right?
Yes.
Because they will trust that you will give the best quality than me.
Mhm. Okay. Yeah. Okay.
Yes.
Thank you.
No issues. So anybody has any doubt, please feel free to ask me.
Ma'am, this is Isha Nandi. So, how do we minimize the data? Means, what kind of code? Is it the like C++ computer coding, or what kind of codes we will use?
It is alphanumeric codes, and initially we will provide you 3 books. Okay, one is CPT, one is ICD, and one more is SCPCS. I'll give you one example. Suppose the patient has, he's saying that he met with an accident and he has a lot of pain in his knee. Okay, so what he will do? He will go to the doctor and he will explain his complaint, right? How he got the pain, where he is getting pain, how severe it is, right? And what the doctor will do? Doctor is not the God, right? He will do some examination, he will do some experiment, or he will do some test. After that only he can conclude what problem he has, correct? So when he is saying that he is knee pain, what the doctor will suggest? A X-ray. If he'll do the X-ray, then he will come to know maybe there is a fracture, because of that he is getting pain. So everything will get clear after doing the X-ray. So what treatment he has taken from the doctor? X-ray, right? So now as a coder, you have to put a code for the X-ray. And after doing the X-ray, what the doctor is saying? You have a fracture. Now the fracture is the patient's diagnosis, right? So you have to find a code for the fracture, the ICD code. Okay. One more book is there, which is known as SCPS. This book we will use when for injections, drugs, chemicals, and the medical equipment, surgical supplies. For example, during surgery they use many devices. Correct. So from starting from tray, needles, syringes, catheters, so many things. Correct. So all these code will be available in the SCPCS book. So it's not coding is not a data entry job, guys. Okay, I'm just making it clear because many people they ask me that, ma'am, there is a book. Why we need the training? Okay, so you need the training because you should understand the coding guidelines. Certain clauses are there, certain rules are there, and these rules comes from Center for Medicare and Medical Services each year. Okay, each year 2 times coding guideline revised. So you need to keep yourself updated with the coding guideline. For example, 2 years back, Corona came to the world, right? So we did not have a code for Corona because before it was not there. So from 2019, there is a new guideline for Corona. So you need to keep yourself updated. It is a field where throughout the life, you have to keep learning and keep updating yourself. Yeah, please ask if you have any more questions, guys.
Hi, Anita, Shiv this side. Am I audible?
Yes, you are audible.
Yes, sir.
So Anita, I am working with a company called Concentrix. They are providing services for 8-9 in US. So basically, my question is that the HCPCS or CPT is globally code. They are used in the global form, or it's specified for a country.
It's a global form, but again, it is specified for the countries because if you will go Australia and Canada, so their coding system is little different as per their rules.
Okay,
Their
and
country rules.
this is a medical coding program, so it's only belongs to medical. Recently, I worked with EXL, so they are doing in property or paid, or you can say motor insurance. So there is no codes for that scenarios.
Yes, right. You are right. Okay, motor insurance and all, we have code, we code the external cost codes more for those industries.
Okay, fine.
Yes.
Thank you.
No problem.
Hi, Anita.
Hi.
Hi. I would like to ask you one more question that if I appear for AAPC exam, do I have to borrow my own books or center will provide me the books?
Center will provide you the book.
Okay.
Yes,
So
you cannot carry your own books because own books maybe have some markings and all. To avoid that, center provides the original copy of the book during the exam.
okay. All good. Thank you.
No issues. I wanted to show you the module, guys. Okay, what includes in medical coding curriculum. I hope you can see my slides, right?
Ma'am, can I ask one
Yes,
question?
Yeah, just give me 2 minutes. I'll just complete this slide, then you can ask me the questions, right? So you can see starting from module 1, we have, I think, till module 23. So if suppose somebody is not from life science background, right? So how he will understand the medical terminology. So that also we cover in our medical coding sessions, okay? First few sessions will be on medical terminologies, anatomy and physiology, because the base of medical coding, you should have little bit knowledge on the medical terminologies, right? Suppose, the doctor is writing BX. The doctor that writes a lot of short forms because they don't have that much time, correct? So, but as a coder, you need to know what he is writing. He's writing BX. BX ka matlab hota hai biopsy, means he has done a biopsy. So like that CP, they write C X-ray. What is C X-ray? That is chest X-ray. Okay, so you just need little bit knowledge on the terminology. Sometimes they write, nephritis. Nephritis ka matlab hota hai
information of the
right. Nephron belongs to kidney. Nephron is the medical terminology we use for kidney. Okay, so like that we also revise these things. We also give some sessions on terminology. This is the starting or the base of the session. After that, it followed by, you can see a lot of guidelines here, right? ICD-10, ICD-10 guidelines, JET codes, V codes, X codes. Okay, if it is a motor vehicle accident, how he answer, we use a lot of V codes, W code, external cause codes. Then we have each sections in your book, whatever sections we have, we explain that one. Along with that, although ICD 10 CM guidelines, 22 chapters are there, 22 chapters guideline you have to complete. After that, there will be assessment. Okay, so in our portal there will be assessment. It is MCQs. You can attempt multiple times. After that, you will get a certificate. And our institute is affiliated with AAPC, American Association of Professional Coder. It is the body who conduct all the coding certifications. So when you clear this assessment, we will give you a certificate like this, where you will find AAPC logo in the certificate. You can see which is highlighted in yellow. So I don't think any company here in India, they give this logo in their certification.
Your institute is AAPC certified, right?
Yes.
Okay.
We also help the participants who wants to take any certificate from AAPC. We also do all the registrations from them, because many people, they don't know how to do this, because it's not an easy process, because you need to pay in dollar, correct? And it's a little bit complex process if you want to directly do the registration from the website. So there also we help you if you want to do it. And once the entire complete medical coding training session is done, 90 hours, after that we give internship class. Internship means you will learn the live work, you will get the live work experience, you will learn how to work in an organization. Means in organization, whenever you will go and work there, you will get the patient's chat, okay, patient's medical record. So we show or we explain those medical records, and they are coding in the internship class, so that whenever you will join in company, you will feel comfortable, you will be more confident, you will have a very good knowledge compared to the other people. Okay, so that's it. And all the session will be virtual. If today you are missing any class, you can't able to join my class today, tomorrow you can review my recordings, or anytime you want to revise, recordings will be there in your portal. You have the access all 24/7. Okay, so that's it from my side. If you have any, we have a placement assistant cell also. So if you have any queries regarding placement, you can contact them. If you have any query regarding the payment, you can contact them. If you want to register for the exam, you can contact them. Yes?
Ma'am, is online course, offline course?
It's online, no
Where
offline.
Is where is this branch?
Branch is there in most of the place. Bangalore, Delhi, okay, Pune, I think, Mumbai.
Yeah.
You can see the Henry Harvin website. So you will get
Yes,
the
ma'am.
details there. Okay. So,
Okay, ma'am.
okay, guys, let me know if you have any type of questions, you can just ask me.
Anita, one thing.
Hello.
Yes.
Which duration of internship?
Internship will be for 1 month, weekly 1 hour session.
Yes. Thank you.
Yes.
Anita, again, shift this side. If somebody is not clear the assessment, so what is the charges or what is the procedure for his next attempt?
It is MCQ. I think it is multiple attempt. Okay, you don't need to worry unless and until you clear those this assessment. You can keep attempting it.
Okay.
Yes.
Hello, ma'am. Excuse me, ma'am. How much the fee, ma'am?
Hello. Yes, Katie ready, right? Yes.
Yes, ma'am.
Fees is right now 59,600. But please, regarding the fees, regarding the placement, please connect to your respective RM. Okay, so they can give you a
Ma'am,
better clarity than
we
me.
will pay the one time lab.
That is what I'm saying. See, I am a trainer. Okay, so this is not my department. So that department is different. So
Okay,
you
okay.
registered your number, right? They will get back to you, I think, by tomorrow.
Oh, okay, ma'am. Thank you.
No issues. And regarding the schedule, I can tell you, okay, we have the sessions on every alternate days also. We have the session in the weekends also. If you are working and you cannot take the trainings on weekdays, you can join on weekends classes. It's up to you.
Ma'am, how many months the training period?
See, total is 90 hours. It will take max 3 months.
3 months.
2
Okay,
to
okay,
3
okay.
months. Yes.
Hi, Anita.
Hi.
Good morning, Anita.
Good morning.
Yeah, myself Ramesh. So I'm from Bangalore. I have a couple of questions.
Sure.
So actually, first question is, so now medical, it is a healthcare is a growing industry. So I can agree that. So now the robotic system is coming. So I can hear that in my process also. So it's a robotic process is coming.
Is it
So how
coding?
it will robotic means the whatever we are doing work. So how
AI, he
Is
means
it
AI.
coding? I'm asking, is it medical coding?
it's not medical coding. So I'm working in medical industry.
Okay, see, medical coding cannot be automated. It's already tried. Okay, so
Okay.
because the automated system is not giving 98% quality, and this is a very sensitive field because all the transactions happens in dollar. Okay, so it cannot be robotic. It cannot be automated.
Okay. So my next question is,
Yeah.
so you are telling the training, the medical coding covers the ICD-10. So ICD-10 and HAPIX code. So what about this procedural codes? So that is
Yes,
only for
I
the
said 3 codings, right? CPT, ICD, and SCBCS.
yeah CPT. Okay.
Yes.
So it covers
No issues.
yeah.
We cover 3 coding and we deliver your books to your postal address, the hard copies of the book. Also, you will get the soft copies of the book in the portal along with the material and the assignments. The trainer who is taking your training, they will upload all your training material assessment in your portal.
Yeah, because presently I am using ICD-10 and CPT codes and HAPIX codes. That's the 3 codes I'm
Yes,
using.
same thing, same thing.
Okay, so how the difference between that medical coding? Because I am also now presently I'm using that ICD-10 code. So why I have to take this course? So what is the difference?
I didn't understand your point. Can you come
No,
again?
actually, no. Presently I'm working for the claims, so I'm using ICD-10, CPT codes, HAPIX code. All of 3 I'm using. So if I take this course, what will be the extra benefit for me? I'm asking.
But I
Because
don't know in which role you are in.
no,
So are you a
I'm
medical
into,
coder?
yeah, I'm into medical code. Yeah, I'm processing the claims. I'm using the ICD-10 CPT codes because my work is to
So if you
code.
already know the coding, then there is no need of this session. This session is for the people, right, who doesn't know coding, who wants to start up their career as a coder.
Anita, sorry to interrupt you. He's just saying like he's working as a claim adjudication process. Like he processes the claim. He knows the code exactly what is the medical coding, but
Oh,
he
I
want
got
to
it,
know.
got it. You are in
Yeah.
claim adjudication, right? You
Yes,
see
yes,
the
exactly.
LCDs, NCDs, and accordingly
Yes,
you
exactly.
validate it, right? But you
Yeah,
don't generate the code, right? Codes will be there with you. Am I right?
yeah.
So if you take this course, then you can generate the codes, right? Because you
Okay.
are getting the ready-made codes with the reports. Somebody else already put the
No,
reports
Anita,
there.
sorry again to interrupt you. Like the same profession I am working with. So in our profession, we have to just mention the disease and the codes appear in the system. Like whatever software we are using, the system automatically pull the code. So just the simple thing, how it's beneficial for us if we are practicing or we are doing the medical coding.
Correct. I will tell you one example. Okay. So one example, suppose there is a patient who is actually she is a pregnant woman and she has diabetes which is due to her pregnancy. Okay. It is not like she has a pre-existing diabetes. Okay. So but what happened? I told you she is a pregnant woman. So whenever you are diabetes for a pregnant woman, you have to put the code which is during the pregnancy, not pre-existing. But the coder has put the diabetes
Gestational
or
diabetes.
pre-existing. But if you know the coding guidelines, then easily you can rectify the ICD code. Otherwise, your claim will get rejected. So this is called ethics or
Yes,
guidelines on medical coding.
yes, Anita. We have for all the specialities, all the so even it is the gynecologist. So we are coding based on the what patient's requirements because he have multiple means what
Diseases.
diseases. Yeah.
So do you
So
know
we cannot put.
exclude one rule? Do you know
Yeah,
exclude
yeah,
rule?
yeah, yeah.
Then,
We have.
then you know already coding. So I don't think there
No,
is
no, no.
any need of
Yeah,
this.
yeah, yeah. Just I'm saying. So how it will that course it will the certificate it will help or like that I'm asking.
No, if you're already a coder, then I don't think it will be helpful for you. You
Oh.
can go for coding certification exam to boost your career. That regarding training you can take here.
Okay.
CPC certification advanced training that will be for 8 hours.
Okay. So one more thing, this is the question. So, Anita, is there any, you have the provider credentialing? So is it helpful for the medical coding?
Provider coding is very different. Okay, it's little complex. Yes.
Yeah. So
you are working from insurance companies, right?
yeah, in US Health.
Yes, insurance company coding is like codes will be there. You just need to check the accuracy. Okay.
Yeah, I'm a head
Provider
of.
coding is very
Yeah.
different. You have to generate the codes. You have to read the report. There will not be any EHR. In EHR also, you will not get the auto-populated codes. If you will get also, you have to validate it.
Yeah, because so first I have the experience of this coding, so I'm into the next level provider credentialing. So I'm asking, just is there any medical coding for that provider credentialing?
Especially provider credential, see, this is the basic medical coding training program which you can use this knowledge in both in insurance and the provider side also.
Okay, is this helpful for the domestic? Domestic means so I'm working for Indian insurance system.
No, not at all. There is no correlation because we provide only for US as per the US hospital guidelines, because 80% of the work being outsourced from US.
So in this course, Australian, we have the Australian course different and
only thing is that here it is ICD-10 CM, they have AM, ICD-10 AM.
Okay, so it won't cover Australian course.
Yes.
Okay, thank you.
Yes, no problem.
Hi, Anita.
Hi.
This is Anjali. Actually, could you give me a little bit of details about AAPC exam? Means, yes, please.
See, AAPC, right? It is an organization which is there in US who conduct all the codings worldwide certificates, right? So they have many certifications like CPC, COC, CIC. Okay, as per your requirement, you can take, but mostly all the companies demand for CPC. It is very common. Okay, so in CPC exam, you will have 100 questions. All is MCQs. No negative marking, and you just need to score 70%. Means out of 100 questions, you have to give the correct answer for 70 questions. If you are giving, then you clear the CPC exam. One more point is that, so whenever you are booking for the CPC exam, you can book for the 2 attempts, free 2 attempts. Means if suppose you didn't clear the certification in 1 attempt, so you can see your percentage in the website, okay, where you went wrong or in which section you have scored less. Accordingly, you can put your effort in that section, and next time you can take a free retake.
Okay.
Anita should decide. If I want to just appear on the exam, so what is the scenario for that? Like I'm working for medical profession and I know about HCPC, ICD-10 or CPT. So I directly want to appear for the assessments. So what is the procedure for that?
Yes. So what you have to do is, first you have to be a member of AAPC. This is mandatory for each individual who wants to take a certificate from AAPC. Okay. Every year you have to pay some I think $200 for to continue your membership in their portal. Okay, once you are the member of AAPC, you can apply registration, or you can do from your side for the registration, okay, for your exam. Locations, they will show you in the website where you can take. So right now, I think online examination is not there. You have to go to the center and you have to take up the exam.
Okay.
Yes, 70% is the cut-off mark.
Okay. Thank you.
No issues.
And they provide me the books at the center, right?
Yes, they have to provide you the original copy of the book.
Okay. And is it mandatory to do a training before appear to that exam?
Yes. Take mock test. Okay. Give one mock test. You will know where you are standing. Okay. In the mock test, if you're squaring 80%, then definitely you will clear the exam, because generally the mock test which we prepare, that's little difficult compared to the original CPC exam papers.
Okay, okay.
Ma'am, how many
And
times you will attend the exam?
Two times.
2 times.
Yes.
Okay, thank
So
you.
CPC exam is nothing. It's just the time in management and how smartly you are eliminating the wrong options. Smartness is needed. Okay.
Okay.
Doesn't mean that you should have very good knowledge in coding. You should have, but smartness also matters. How you are managing the time.
Okay, ma'am. Thank you.
No issue.
Hello, ma'am. Means
Yeah.
is this offline exam?
Yes.
Okay.
Offline exam is far better than online exam, guys. Okay. Because somebody will be there in the center to, at least guide you. If something happens in house, what you will do, right? Nobody will be there with you.
what would be the duration of that exam?
It is 4 hours.
It is for 4 hours, 100 multiple
100
choice questions.
So you have 2.5 minutes for each question.
Okay. And what would be the fees?
I think it is 500, $600. I'm not sure. I need to check in the APC site. So it will be within that $500 to $600.
US dollar. Okay.
Right. So if you want to take the exam, okay. So as Henry Harvin is affiliated with AAPC, so they can do your registration, the same amount which you are giving to AAPC. I think you can give the same amount to them. They will do it. They will make your work easy.
Okay. So means, okay. And if I do training from Henry Harvin, so will you provide me?
Where is the exam branch?
Will you provide me? Sorry, I'm still asking the question.
Yes. Yeah.
So will you provide me the books?
Yes, of course. So 3 copies of the books will be shipped to your postal address, and also you will have the soft copy access in the portal. Okay. Along with that, whatever assessment and all that will go on throughout the class. So one more very important point: medical coding is not history, geography, or English, where the trainer will just read out the guidelines and you have to hear all about its practice. Okay. As many as questions you will practice, so as many as scenarios you will face, then you will have more confidence on everything. And this medical coding is not about only one specialty, right? You can see when you go to hospital, there are several specialties like anesthesia department, pathology, radiology, right? So in this training you will cover all the guidelines, CPT guidelines for all the specialty, evaluation management, emergency department, everything. So you will have many confidence after doing this basic medical training program. But if you want to go for those who are working in one specialty, so they generally don't get the exposure to other specialties and they lose their confidence. Yeah, Anjali,
So
go ahead.
okay, so so when you provide us book, that would be the original copy, not the Xerox copy, right?
No. All the company, all the institute, they only provide the Xerox copy. Nobody will provide you the original. Do you know how much is the original copy charge?
Yeah, they are
From
very
US,
expensive.
yeah.
Yeah.
Yes.
So you will provide us Xerox copy, right?
Yes, Henry Harvin will provide you the hard copies, photocopy, and also the soft copy access.
Okay, all good. Thank you.
No issues.
Hello, ma'am. This is
Yes.
Megha. Ma'am, I have passed out in 2013, and now I joined. I want to join this. Is there any impact?
Nothing. From which background you are?
Gap is there?
No, from which background?
Pharmacy. I am pharmacy graduate.
No gap, nothing matters. Okay, go ahead.
Okay.
Very sensitive field, guys. Okay, medical coding. One information goes wrong, your all course goes wrong, and the dollar value is 0. So, any more questions?
Yes, ma'am. Excuse me.
Yeah.
Ma'am, where is the final exam branch? In Delhi or Bangalore?
Sorry, what happened?
Exam, ma'am. It's final exam.
Final exam. Final exam is online. You don't need to go anywhere.
Okay.
Yes. The certificate which you will get from Henry Harvin, you don't need to go anywhere. It will be in your portal. Just attempt for it. That's it.
Okay.
Okay.
Yeah, hello, excuse me, ma'am.
Yeah.
Yeah, myself Vishnu, I'm from Hyderabad.
Hmm.
So I have done my BSc in medical lab technology and the MSc biotechnology course. When after completion of your course, how much I can expect from the company salary? I'm asking about salary.
Salary. See, salary, it is not like, I can give you a fixed, rate like this much you will get. Everything depends on your performance during the interview. Second thing is, it also depends if you have a experience before, right?
Yeah, that is the reason I'm asking.
Internship.
If
So
I get, yeah, I will be the fresher.
if you are a very fresher, you don't have any experience, nothing, 20 to 25 minimum you can earn without any experience.
Okay. I know, and you are providing any references to any other company?
This goes to the placement unit, Vishnu. Okay, so they will help you in that.
Yeah.
Okay, yeah.
AAPC certification is helpful to go to abroad in any other countries?
Yes, go anywhere. But don't go to US. Okay, because they outsource their work to us. Okay.
Okay.
Hello. Ma'am, is laptop is necessary to work on medical?
Laptop is not at all.
Or it can be done on time book?
Pen book you can do it because you will get the hard copy of your book, right?
Okay.
You will get the hard copies, Xerox copy of the book, correct? So it's not like that.
After completing training, we will work on any company. That time we need a laptop, or we can done on a prime book.
See, that is a different thing. Okay, I don't know about each company's standard, right? It's all depends on what they want. They will provide system, laptop. It's up to them, correct? How I will come to know. Whoever provides work, they also provides you the resources. Okay, like systems and all.
Hello, excuse me, ma'am.
Hmm.
Ma'am, I wanted to ask that what is the success rate, ma'am, after doing this course? Like, how many percentage of students clear the CPC exam after they do your this training course?
Yes, just check with the HR department of the STEM. Okay, I think the person who is in touch with you, just ask them your respective RM. They have the data. They can tell you. I am just a trainer here.
Okay, ma'am.
Okay. Yes. See, if you will, and guys, one more thing. So if you think that if you will go to a best training institute and definitely you will clear exam, nobody will give you the guarantee, right? So because everything is up to you, how you take up the things, right? What effort you are putting. Even though the company success rate is not good in the past, but you can see a lot of students, they can clear up the exam on their own effort also. So you cannot blame any of the institute, right? You can take it is in a positive way if more people are clearing it. But that should not validate your confidence level, correct?
Correct.
Hello, ma'am.
Yeah.
I'm Kisan Sonone.
Right.
I have one doubt. I have 5 years of experience in medical billing, and I am a commerce graduate. Can I do the medical coding course?
Please do it because you already know, Bill, you are doing medical, right? You know already many terminologies in this industry.
If I complete,
Go ahead.
if I complete this course and if I go for interview in any other company, will they consider me? Because I am not
Now
from
companies
science
are,
graduate.
I will tell you, Sony, now companies are very open to take the people who have multi-talents because, coding industry is like, it is a mixture of billing also. They do billing, right? So if one person can do coding and billing, that is well and good for them, right? Why they will hire 2 people? So obviously they will give preference to you. You got my point?
Yes, but there will be no problem for a non-science graduate candidate.
None?
Because I am not from science field and I have 5 years experience.
No
And if I
problem. No problem. You
So
already
then,
know billing, right? You know the terminologies, codes,
yes.
everything. So that doesn't matter.
Okay, okay.
Okay.
Thank you very much.
No issues. Okay, guys, I'm just giving you 5 more minutes of time. If you have any questions, please ask me. Otherwise, I'm going to close the session.
Hello, ma'am.
Sure.
My background is BA English. Can I do it or only
BA in English. You have to put little more effort from your side. Is that okay?
Yeah, it's fine, ma'am.
By job wise, if you have a doubt whether I will get a job or not, you will get a job. Okay, once you're done with this. But to understand this, you have to put little bit of effort from your side. I am very straightforward. Okay, I'm not doing the marketing of medical coding. Okay, so if you cannot do, I will straightforward. I will say you cannot do it. Where you can do it, I will just say put little more effort from your side. Nothing is impossible in this world, right?
Okay, ma'am.
Because
Hello, ma'am.
yes, after 1 second, after doing BA, what you can do? You cannot do anything. Either you can go for a BPO job, right? So vice process, BPO, there you have to work full night. So instead, if you're putting some effort in your, in your total time, then you can find out a best career here in medical coding. Okay, that's why I said. Yes, please go ahead, Kisan.
Yes, ma'am. Yeah, I have one doubt.
Hmm.
Actually, I am 38 years old. So, is there any age criteria that company will hire
No,
people?
don't worry. Don't worry about age. You know how many people are from medical transcription is coming to medical coding because transcription is not there and their age is above 45, 50. So what they will do? They are coming to medical coding field around, so they are doing medical coding, no age limit. But again, see, Kisan, all the companies are not doesn't follow the same rule, right?
Correct.
But I know many companies are there where age is not a matter. Nobody sees the age. But some companies are there, they will see everything. So that's a different case. So you
Yes.
always see for the positive side and go ahead. Okay, don't see for the negative side.
No, I am seeing the positive side, but company there will be company requirement, no. So this group will apply age criteria.
अरे एक
Something like
कंपनी
that.
अगर आपको नहीं लिया तो बाकी 10 कंपनी तो है ना. Why you are looking for only one company? You see for the other 10 companies who are open to you.
Yeah, just for a question. That's why I asked you.
No issues.
Okay, thank you.
No problem.
Hello, ma'am.
Yes.
Ma'am, diploma and pharmacy student eligible in medical coding.
Yes.
Okay, ma'am.
Okay, so how is the webinar, guys? All good?
Yes, ma'am. Yes.
Okay, guys, then I wish everybody all the very best. Okay, so you just
Thank you.
connect with the respective RM if you have any questions on placement or payment or anything. Okay, so all the best to all of you. So take care. Bye. Have a good day.